How are you?
I'm doing great.
Kimberly White here. Lake Mary Health and Rehab is where I work. I'm currently a CNA. Been there 7 years and a proud member of the union all 7 years.
Well, thanks for having me, Kimberly.
No problem anytime. Thank you for showing up.
You bet, always.
So I guess we'll jump right into the interview here. A few questions we want to ask you regarding union workers' rights and what it is that you're currently doing. Sounds good?
Sure,
Okay.
sounds great. Important topics.
Okay, now the first question is, as union healthcare workers, what would you say are the two biggest challenges blocking our ability to provide universal access to healthcare in Florida?
Well, I'd say it's coverage and wages that are too low right now. First, with regard to coverage, when the Congress passed the Affordable Care Act, it greatly expanded coverage, including here in Florida. In fact, it actually reduced the uninsured coverage by about 33%, and that's because there's a lot of folks who work in Florida, particularly in my district, and the tourism and agriculture industries and others, that don't have access to reasonable employer-based plans. So the exchange helped out a lot. However, you have this gap of folks who are a little bit above the poverty line but below 400% of poverty line. They fall in this Medicaid gap. Our state, I fought hard during my days in the state Senate to try to expand Medicaid, but we were rebuffed by Rick Scott and the Republicans on that. So you have almost 1 million people. These are folks who are a family of four, maybe making $40,000 for that family of four in total, who fall in this gap. So that's a lot of people. Hardworking people working 40 to 50 hours a week, potentially two breadwinners who still are going to have trouble. The other part of the coverage issue is we saw Trump cut the CSRs, the cost-sharing subsidies that were helping folks who are sort of middle class to a little upper middle class who are on the exchanges. So they saw their rates go up 40 to 50%. And I think people need to understand as they're watching this, we're all familiar that Trump has tried to sabotage the ACA, but people don't necessarily make the connection between the subsidies that he cut and the fact that insurance rates are going up 30, 40, 50%. And one last thing I'd like to talk about in the coverage aspect is Medicare for all, or at least increasing the eligibility for Medicare. We could argue over single payer and trying to get everybody under one paying system, and certainly I'm open-minded to that, and I am a co-sponsor of the Medicare for All bill, but at the very least, we should be lowering the age of eligibility for Medicare to potentially 55 or 50. I have a lot of constituents who have been through a lot of town halls where they're going to have a birthday party, a big old party when they turn 65, because right now they're paying $1,500, $1,800 a month, and it's not sustainable. And we know as people get older, they get more health problems. So at age 50, 55, 60, we're more likely to see the highest risk patients. And we have great cures in America. That's the beauty of it right now, but we really need to get these folks in better coverage. And then with regard to, so that's to cover all the patients so everybody can see them. But there's also the wages and benefits issue. I'm really proud of SEIU for the good work that they're doing to collectively bargain. I know the right side of a picket line, and I've gotten to march with y'all quite a bit. But it's a constant battle to make sure that our caregivers are also not living in poverty. I'm a supporter of living wages and of having a minimum wage of $15 an hour. A lot of folks are making $10, $11, sometimes $8 an hour, and in Central Florida in particular, as things are getting more popular around here, it's a more popular place to live, it's tough for someone making $10 an hour to find any place to live, even if they work 40, 50, 60 hours a week. And so that obviously concerns me a lot, as well as the benefits issue. I believe the solution is predominantly collective bargaining and raising up the minimum wage, as well as helping out to make sure that when there is strikes, that I'm there with you all to put the pressure on them. There's a lot of other issues that come into it, but those would be the two big ones, I think.
Okay. Now, what opportunities exist for those who are currently unable to access healthcare in Florida?
Well, first, we need to see where you're at on your income spectrum, because you could be eligible for Medicaid. And while it is a pretty stringent program around here, we still have many folks who are children, seniors, persons with disabilities, and returning veterans struggling with PTSD, many people who qualify because of their income. One of the more robust programs that's been a huge success has been the Kid Care program, the child health insurance program that was founded by under the Clinton administration. That's been a smashing success. A lot of parents, they don't fully realize that that's the CHIP program. They may have heard of Kid Care, but they know that their kids get covered through a low-cost insurance policy through the schools, and that program has really helped make sure that our children are all covered. But sometimes when people come in halfway through the school year, they may not be aware of it, especially if they came from another state, so we'll get questions on that. Obviously, seniors, if you're over 65, you qualify for Medicare, and we talked a little bit about lowering that, and certainly that's something I'm supportive of, or potentially expanding it out to every American. And then on the exchanges, we have a lot of good opportunities, but let's face it, with all those sabotage that the Republicans have done to the plans, there's a lot of things that we need to fix, and a Democratic majority would do that. The cost sharing we talked about already. The enrollment period, we need to double back again to be 90 days rather than a month and a half. We need to have marketing dollars. We need the risk corridors to be established again to make sure we have more choices in the market. And so those are a few things that we could do to shore up the exchanges as well. And we ended up, we'd have to get the individual mandate back, but we would keep the reform that got rid of the tax on Cadillac plans, as they call them. A lot of unions have fought over decades to get robust health plans for their members, and if they negotiated over those years to get those plans, they shouldn't be taxed extra for them. So there's a lot of things that need to be done to help with folks to get on the exchanges, but keep in mind that's something that every year there's enrollment for, and that's another opportunity as well for people to get covered.
Okay. Now, what are your thoughts about the ongoing attacks on workers' rights to collectively organize in a union?
So we've seen some really big blows to collective bargaining over the past 2 years in particular. First, on the state level, in Florida, in the state legislature, they passed a law that would automatically decertify a teachers union if they got below 50% of the teachers. The good news is that had the opposite effect. It actually surged enrollment because a bunch of people realized they weren't going to be covered anymore by collective bargaining, by their unions, and that free rider problem went away. But this law is still bad. We shouldn't be putting together laws to attack unions. You know, a lot of my peers on the other side of the aisle, they always talk about the free market and letting people negotiate arm's length. That's what collective bargaining is all about. It's about the workers getting together and getting leverage to be able to bargain on an equal level with the employers. And so when people say that, they don't really mean it if they're attacking our collective bargaining and our nation's unions. In addition, we saw the terrible case of AFSCME v. Janus, another free rider case. Free rider in that you have every state, federal employee benefiting from this, and I know SEIU also is going to be substantially affected because you all represent some government units as well. But many of these unions that represent government workers, you know, all of them get the benefit of the bargain, even though they have traditionally, in certain sectors, not have had to pay. In the government sector, that's been different. Among federal, state, and local employees, they've all had to pay in, and now the Supreme Court's saying you don't. That's going to just create free riderism, which I mean that people get the benefit of the deal without paying the union dues to help get that organization together to be able to organize and negotiate. I am committed to working with any of our local unions throughout the state of Florida that are affected by this decision. If there's any attempts to decertify, if there's any elections, if there's any intimidation, because now, rather than having the blanket protection, which I believe would have been the right decision, they're really reversing course on the Constitution on this one. At the very least, it'll be a battle of 1,000 fronts where we'll need to stick together and make sure that our local governments, our state governments, and our federal government is not abusing that. And of course, in Congress, I also stand as an ally to SEIU. We've had some local victories lately, whether it's TSA, whether it's the teachers, as I mentioned. There's been attempts to to privatize. We are working together with you all in Puerto Rico as well to rebuff some of those things. So we continue to work together, and I'm looking forward to continuing this string of victories.
Okay. Now, what legislative issues are you currently working on now?
So right now there's a few things through my committees. I serve on the Agriculture Committee and on the Natural Resources Committee. So one of the big things is fighting to save the SNAP program, our food stamps program essentially. There are huge cuts that the Republicans in the House are trying to accomplish. And in Florida, we have a SNAP system where if you're at 200% of poverty line or below, you qualify. And that's because the rents are so high and the mortgages are so high. Let's face it, Florida's a great place to live. People know it, the word's out. And so they want to lower to 130% of poverty line, and that would kick out 130,000 Floridians. That's more people than California or Texas, two states that are bigger than ours. So obviously on the ag front, that's a huge issue to make sure that families, that children, that seniors, that persons with disabilities, that veterans who are trying to get back on the right track, and others have this opportunity to be able to eat, which is, along with healthcare, a basic human right, I believe, in America and in the world. And so that's a big issue we're working on. We're working on some environmental issues. Those of our brothers and sisters who live in South Florida, they're seeing the green slime right now coming out of the Caloosahatchee and St. Lucie rivers and out into the ocean and hurting our Everglades. I'm working on a bill that is going to provide federal protection to the Kissimmee River, which is the northern Everglades, and it cleans the water going to Lake Okeechobee. But this past week passed two key amendments to protect victims of sexual harassment that I'm very proud of. One would, if you are leaving the military and you're a victim of sexual harassment, it'd give you all the options that you would have for recovery and for treatment. And the other would allow for universities, and we're working on some very cutting-edge treatment for PTSD and for emotional stress for both first responders, assault victims, and others through simulation. That would also now be a part of that. Over the course of the past year and a half, we've passed 4 major pieces of legislation, one holding foreign offshore oil drillers accountable. They had a cap of $1 billion. Just to give you an idea, the BP oil spill cost our state $68 billion. So we're protecting our environment, protecting our beaches and our oceans. We passed a cool bill right before the break to protect sharks and marlins and other major fish in our environment, and also passed a bill with Senator Nelson to protect, to have a second-fit hurricane hunters. These are the airplanes that fly into the hurricane. So whether it's our environment, whether it's protecting our social safety net, whether it is protecting our hurricane preparedness, these are things that we're still able to get through in what is frankly a very tough environment. We're dealing with a Republican majority, a man that I agree with zero on in the White House, and yet we're still able to pass some key pieces of legislation that help out our state, the prettiest state in the union.
Right. Okay, now you've already given us a bit of a snippet there, but how will your continued success on these issues impact your constituents for the better?
Well, I think it's key to think about first what we could continue to do this term, and then what we would do next term should the good people of District 9 bring us back. One is to just figure out continued ways to get key things done that may be bipartisan but are still solving issues that we as Floridians, we as Americans care about. Providing more affordable housing. We've got some money for seniors affordable housing and for veterans affordable housing in the district. Raising up the wages is going to be a tough thing until next term should we get a Democratic majority, which I'm very hopeful for. We'll be continuing to work on issues related to our environment, protecting our oceans and our beaches. We'll be bringing down high-tech dollars for research. We're sitting here in my Lake Nona office in Medical City, and I am a big believer in bringing down federal funds to help our universities do research, and then we have spin-off companies. In 1 square mile around us, there are many biotech companies that are forming, and they're creating higher paying jobs, and they're also creating more health care opportunities, which will help with SEIU members to have more job opportunities as well. And then there's a bunch of things that we would do should we get into the majority next year Number one is to roll back the GOP tax cuts. 1.8, 1.9 to 2.3 trillion dollars in debt, and 83% of this goes to the top 1%. So I challenge many of your members, or myself or others, if they really saw something from this thing. We would roll that back. We would shore up Medicare, Social Security, and Medicaid, and we would put together the $1 trillion infrastructure package that we were promised to really give this nation a makeover and push for more jobs. If we don't take the majority, we've already seen the GOP budget. It would mean $1.5 trillion in cuts to Medicare, $500 billion in cuts to Medicaid, $500 billion in cuts to Medicare, and billions of dollars in cuts to Social Security, which would literally be one of the biggest shifts in wealth in our nation's history. You add in increasing access to health care and fixing Obamacare, getting back in the Paris Climate Accord and taking on climate change. You add in restoring the Voting Rights Act and protecting a woman's right to choose and restoring civil rights statutes throughout this nation, and also shoring up our nation's pensions. Particularly some of our union pensions are in trouble right now, and we can help them. So those are things that would be top on the agenda should we have a Democratic majority, and of course overall putting a well-needed check on Trump.
Well, I want to thank you for coming out to meet with us today.
Thanks for having me.
This does conclude this interview. Thank you so much.
You bet.